ಮೆಂಟಲ್ ಮಾಡ್ಲಾ ಮೊಬೈಲ್ ಕೌಂಟ್ ಮಾಡಿದ್ದೀನಿ ಓಕೆನಾ
Can we start?
Yes, I'll open the room for the attention.
Yeah.
We will now be audible and visible to the
Can we
audience.
start?
And also, we are live on YouTube.
Fine. Dr. Madhu, can we start?
Now you can hear.
Yeah. Yeah, we are live now. I think Dr. Madhu, you can start.
So shall we start the program today? Yes. Good afternoon, everyone. Today, on the occasion of World Epilepsy Awareness Day, called as Purple Day, that's what we celebrate everywhere, we neurologists. The purpose of this program is to create awareness among the general public that epilepsy is a disease like any other disease, and there is treatment available for this. If treatment is given properly, these people can lead a normal life. That is that's why we have to create awareness among the public, especially in the developing and underdeveloped countries, and also especially in the rural areas, because more than 70% of the people are in the rural areas. So for them, accessibility to the healthcare facility itself is a very big problem. So in this kind of situation, we have to disseminate this information that epilepsy is a treatable condition. Today, I am Dr. B.K. Madhusudan, neurologist heading the Department of Neurology in Sparsh Hospital, Bengaluru. And Dr. Sharma, Suryanarayan Sharma, he is a leading consultant in Apollo Hospital, Bengaluru. He is leading neurology department in Apollo. And Dr. Pradeep is assistant professor in Department of General Medicine in MS Ramaiah Medical College. All three of us will be delivering a talk on different topics. And our Honorable President, Dr. Nirmal Surya sir, will be chairing this session. And now I welcome Dr. Suryanarayan Sharma to deliver the first talk about the overview of epilepsy.
Yeah. Good afternoon, everybody. Thank you, Dr. B.K. Madhusudan, Dr. Nirmal Surya, sir, for inviting me for this guest lecture arranged by the Indian Academy of Neurology on the occasion of World Purple Day, the World Epilepsy Awareness Day. Is my slide visible?
Yeah, it's
Yeah.
visible.
So today, next 15 to 20 minutes, I'll be talking about the overview of epilepsy. So what are the learning objectives? What all we need to understand with this overview of epilepsy? First thing, what is the definition of seizure? The seizure types, seizure causes, triggers, and the diagnosis. How do we diagnose the epilepsy? Get seizure smart. Suppose if there is a refractory epilepsy, if patient is having recurrent seizure, what are the first aid things what we need to do? The management of epilepsy, seizure medication tips, the checklist to manage epilepsy well. We need to have a checklist for the better control and the quality of living. Learning your child epilepsy. Child epilepsy is a big, area of interest and research by itself. Understanding your child's risk for SUDEP, sudden cardiac death in epilepsy, helping your child with epilepsy, and coming to the terms with the condition. So what is epilepsy? Basically, if you see the first slide, it is a healthy brain. The second slide, if you see, there is a seizure. Seizure is like a short circuit. In common words, it's like an electrical short circuit in the brain. So epilepsy is a broader term that is used for the brain disorder that causes seizures. In epilepsy, there is a tendency to have seizure that start in the brain. Of course, not all seizures are due to epilepsy. Suppose there's a hypoglycemic seizure, low sugar related seizure, low sodium related seizure. There may be a mild head injury that can cause seizure. So those things we don't call it as epilepsy. Sometimes they are all symptomatic seizure. And epilepsy varies greatly and affects individuals in a different way. So as you all know, the brain has millions of nerve cells which actually control the way in which we think, we move, we feel. In fact, every movement of us is controlled by our brain. But how does it control? It controls using the electric signals. These electric signals send message from one nerve to the other nerve. And suppose if the messages are interrupted, the electric signals do not switch off, or whenever in rest the electrical impulses are not needed. So this can cause brief change in the way in which the brain works. And this interruption or buildup of electric signal can cause a seizure. So in common language, it is called fits or attack. In local language, it is called murcha roga or apasmara. So what is in epilepsy, the normal pattern of nerve activity becomes disturbed, and this causes strange sensation, sometimes strange emotions. Sometimes people will have laughing epilepsy, sometimes they'll have crying spells, sometimes they'll have strange smell coming out of the thing, or sometimes they may have vomiting and behavioral pattern, and sometimes they will have a full-fledged tonic-clonic seizure. Sometimes even muscle spasm is another type of epilepsy. Loss of consciousness is seen in generalized tonic-clonic seizure. So what are the types of seizures you know of? One is the focal onset, generalized onset. Third is the unknown onset. The seizures are classified either as focal seizures or generalized seizure based on how it begins. Suppose, to give an example, a patient may have just a left upper limb shaky movement like this. They may have a jerks of the left upper limb. So usually what happens, sometimes they may have a there may be a lesion in the right side of the brain. It may be a small stroke. It may be a cysticercus, the parasitic infection of the brain. It can be a tuberculoma, that is a TB of the brain. So they can cause this type of focal seizure, any structural lesion. Second thing is generalized onset. That is, the patient will have a generalized tonic-clonic movement with loss of consciousness. It starts abruptly so that we don't know where it exactly started. Of course, the epileptologist will tell, suppose it is a focal with secondary generalized and all that. But for a eyewitness, it looks like a sudden onset generalized tonic-clonic seizure. So the focal onset, and another thing is the unknown onset. Focal onset or focal seizure results from the abnormal electrical activity in one area of your brain. Focal seizures can occur with or without loss of consciousness. The earlier terminology for focal seizure was it was called simple partial seizure. In this seizure, the person is conscious, awake and alert, and will usually know that something is happening and will remember the seizure afterwards. Actually, he will tell that he is having a jerky movement. Most of the patient with focal seizure, they say, suddenly my hand became weak. Suddenly it started moving and I didn't have any control of it for 30 seconds or 1 minute or whatsoever. Then second thing is complex partial seizure earlier. Now it is called focal impaired awareness seizure. Dr. Nirmal Surya sir has joined. Welcome, sir. He is the president of Indian Academy of Neurology. So, sorry, we joined suddenly. I mean, at 2 o'clock we joined. So, we welcome you, sir.
Thank you, Surya. I was in a meeting 1 o'clock onward, so I come here to thank you and best wishes to Madhusudan and Surya, both of you, because it is you people have taken a role of creating awareness across the Karnataka, and I'm absolutely glad and wish you all the best. That I'm sure this program will be successful, and I know that you have been a very active runner group member and chair, and your initiation of 1,000 kilometer by runner group. Please add 7.5 kilometer from my side for today. I'll give you tomorrow's count tomorrow. So Madhusudan, all the best, and I'm sure it will be a wonderful program. Thank you very much.
Yes, sir.
Thank you, sir. So
thank you.
Thank you, sir. To come forward, focal impaired awareness seizure or complex partial seizure. Usually, patient will start with a focal seizure, and subsequently they will have loss of consciousness, and sometimes there may not be full-fledged loss of consciousness. They may be confused. So initially they'll be able to hear you, but they will not react or they will not respond to you. So that is the complex partial seizure or focal impaired awareness seizure. So again, coming back to the type of seizures. So focal onset, generalized onset, unknown onset. Again, the type of seizure: tonic, clonic seizure, sometimes tonic seizures, sometimes atonic seizure, that is called the drop attacks, myoclonic seizures, and even absent seizures. Earlier it was called as petit mal epilepsy. So what is tonic clonic seizure? Usually the seizures people will recognize. This is the prototype. Most of the patients, they just have stiffening, they fall down, and they will have jerky movements for 30 seconds to 1 minute, followed by frothing, excessive frothing, tongue bite, and sometimes urination. And they will go into post-ictal, altered consciousness. They'll snore a lot, and maybe after 15 minutes they get up with a lot of body ache and other things. So this is the classical seizure prototype which a common layman will understand. Next is atonic seizures and tonic seizure. In an atonic seizure, the person's usually muscles suddenly relax and they become floppy. Usually they'll be, suppose if they're standing, they just fall like a pole. They just become floppy and they fall. Usually they fall forwards because center of gravity pulls them front. In tonic seizure, a person's muscle becomes suddenly stiff and they often fall usually backwards. You see, atonic seizure, they just drop like this. Tonic seizure, they suddenly become excited or suddenly become stiff, and sometimes they may fall to the back. Then myoclonic seizure, myoclonus means muscle jerk. Usually myoclonic seizure, sometimes even, I think many of you would have experienced when you start sleeping, suddenly you may have a brief jerky movement like this. So that is called myoclonic jerk. So that is not abnormal, especially when it starts with the sleep. But it is abnormal when patient is awake, or in the early morning hour. If it keeps happening, then it is abnormal. There is a special type of epilepsy called juvenile myoclonic epilepsy. Then absent seizures, typical absence or atypical absent seizure. Usually what happens in school, teacher would have noticed, and teachers will tell the parents that your son is just looking at the board or staring at the board. When we call his name, he's not listening. Or when 3 or 4 people are interacting or doing a group discussion, suddenly your kid becomes totally blank. He just stares at us, he just looks through us, he doesn't remember anything. So that is a type of absent seizure. And usually the unresponsiveness is for few seconds. Atypical absence, usually it starts similarly with typical absence, but it ends more slowly, and it lasts for a longer period of time. So what causes epilepsy? Anything that disturbs the normal pattern of activity of the nerves that results in seizures. Usually, if you see the common things, head injury is very common, brain damage in the child in the prenatal or perinatal cause, brain infections, common is tuberculosis, neurocysticercosis. Now HIV with meningitis is another well-established entity, and stroke, very common with stroke, especially involving the frontal or temporal lobe, the brain tumors, and congenital or sometimes genetic factors. Genetic factors, usually it passes down from one generation to the other. Sometimes it may not be inherited, but there is a change in the person's genes. And structural change, I said, as about the brain injury, tumor, stroke, or even the brain infection. So what causes epilepsy? Even if seizures start after a brain injury or other structural change, this may be due to both the structural change and the person's genetic tendency to seizures. Many people might have a similar brain injury, but not all of them develop epilepsy. So how do we diagnose? Suppose you, as a layman, as a common man, you identify somebody has collapsed in a public place, like in a shopping mall or in a road or in a bus stop where you are standing, you shift the patient to hospital. So suppose patient may be having fever, patient may be having low sugar, patient may be having low sodium. They are all common and treatable conditions. So high fever, sometimes febrile seizure, or sometimes secondary to head injury, patient may have seizure. So this is not epilepsy. Sometimes treat the cause, and maybe after 3 months you can stop the fits medicine. Only when a patient has 2 or more unprovoked seizure, so there is a seizure is coming, but we are not able to establish the reason why it is coming. So only when a person had 1 or 2 more seizure, then he or she is considered to have epilepsy. The common tests what we do, a CT or MRI, then EEG, the electroencephalography, which is a measurement of the electrical activity of the brain. So how do you help a patient? So there are 3 S. One is stay, safe, side. Stay means what? You stay with the person till he is awake or alert after the seizure. Suppose there is a patient with seizure and you are the only person who has witnessed it. Please ensure that you stay with him, or at least till you get a help from somebody. You keep the patient safe, because there may be some sharp object. He may be sitting at the edge of a, maybe in a 2nd floor or 3rd floor where the risk of fall is quite high. There may be some sharp objects near him. So please keep the patient safe. Suppose if the consciousness is taking a lot of time to recover, shift the patient to a nearby hospital. Otherwise, suppose you get some medical help, then you can proceed with whatever you are doing. But please stay with the person, keep him safe. These 2 are most important. Then turn the patient to one side. Suppose patient may be just lying down like this with seizure. The risk of aspiration is very high. So just turn the patient to one side and allow the jerks to happen. At least usually most of the GTCS will settle down in 108 seconds. That is the maximum type of a single episode of generalized tonic-clonic seizure. So what you should do is don't press on his shoulder. Don't try to avoid those violent movements. Sometimes they may break their bone. Sometimes you have seen people sitting on one person's shoulder to prevent the jerk. Actually, that will break the bone and that will make him bad actually. Only thing what you need to do is keep the airway clear, turn to one side. Suppose if he's having tight cloth with a tie and all, you try to remove that so that he feels little comfortable. Put something small and soft. Suppose there is a towel or something, you just put it behind the head. So what you should not do, do not hold the person down or try to stop his or her movement. Don't put anything in the mouth. Suppose only thing you should do is, suppose if you find a small soft towel or soft tissue, you can just put it between the teeth so that he will not bite the tongue. Otherwise, if already tongue bite has already happened, please wait till the seizure attack is over. Don't push something. Sometimes he may choke. Do not try to give mouth-to-mouth breathing. Seizure patients, their breathing will be fine. Don't do CPR. Wait for suppose if there's active violent jerks happening, what you should do, just wait for 30 seconds to 1 minute. Don't panic. So if you wait for 30 seconds to 1 minute, most of the seizure attacks would have settled down. Then you stabilize the patient. And immediately, after that, don't try to feed him with water or some food, because sometimes that may, especially in low sugar patients, if he is not conscious, don't give him anything. Shift to hospital or start an IV line and give 25% dextrose. If most of the houses will have a glucometer now, you check sugar. If sugar is low, you give glucose IV or shift to hospital. Don't offer anything orally. And avoid CPR. Don't do CPR on epilepsy patient. I've seen patients having seizure and somebody, pressing on the chest. Actually, we have seen some videos of, patients come with video. They may do it with a good intent. Actually, they don't know what to do. They want to help their family member, but actually sometimes they would have broken the chest bones, and the purpose of the CPR is not served actually. And when to call a doctor, most important thing. Suppose if seizure is lasting, suppose one episode of seizure has happened, it settled in 1 minute or 2 minutes, then again patient had one more seizure. So that means, the recurrence of seizure is quite high. So shift the patient to hospital. Or if the seizure has lasted for more than 5 minutes, still conscious, there is no consciousness at all. So that is another thing where you should call the doctor. And when you should go to the hospital, suppose if it's a first episode of seizure, no matter what, please shift the patient to hospital for assessment, because next 24 hours risk of recurrent seizures will be high. It is the job of the doctor or the neurologist to see why the patient had seizure, and they will settle down. Difficulty in breathing or waking after the seizure. If there is a breathing difficulty, please shift. Suppose, as I said, recurrent seizure within 5 minutes or 10 minutes. Patient is having continuous seizure, what we call it as status epilepticus. There is no role for any home care or anything. Patient needs to be in ICU. Suppose patient is elderly patient is a diabetic, patient is having a heart problem, BP fluctuation is too much, or if patient is pregnant, please admit patient for 24 to 48 hours for observation. Suppose patient had an injury. So that is another thing wherein you should help. And seizure happening in water. There is something called reflex epilepsy, which may, suppose a person from the swim board, he dives into the water. Sometimes they'll have seizure. They may drown. Please help them, shift, make him safe from water, shift the patient to hospital. So these are all the situation. Only thing probably I would say the home management of seizure is in a non-epileptic. If he has one more attack of seizure, you would have done MRI, you would have done EEG, everything you would have done. That is the only time when you can relax. Otherwise, please take doctor's help when somebody is having seizure. Don't relax, don't neglect. Then what are the common triggers? Most important, lack of sleep. There are studies from this army soldiers, pilots, where they'll be sleep starved. 4 days they will not be allowed to sleep actually. There are studies wherein 2% of general population can have seizure, if 2 to 4% if they miss their sleep. Taking excess alcohol, another thing. Stress. Nowadays, all of us are stressed out. Definitely, stress will trigger a seizure in an epileptic. Stress alone will not cause seizure. Just because one patient had seizure and he is stressed out, don't label him as a stress-related seizure. Stress would have definitely triggered an underlying problem. Then missing the medication. This is the biggest challenge. What I think my other co-panelists will agree, that missing the medication may be responsible for almost 70% of recurrent seizures or breakthrough seizures. Then flashing light, photosensitive epilepsy. Sometimes you are driving a car, suddenly, the opposite car does a high beam, low beam continuously. Sometimes that may trigger a seizure. So how do you monitor a seizure? Usually maintain a seizure diary. Usually now a lot of apps are also available, but usually what you need to do is you ask the patient to record the medical history, seizure medication, side effects. Even sometimes even we give a card actually. Suppose if patient falls down in a public place with seizure, he may have a card telling that I am epileptic or I am seizure patient. These are all the medication and probably the contact doctor or contact hospital's emergency number also, if they carry, that would help them. So a description of seizure also would help the doctor, because he may have been assessed by some other doctor. Suppose he may come to Apollo Hospital, Bannerghatta Road, for initial assessment, but he may fall down unconscious in Yeshwantpur. Then he may go to Dr. Madhusudan. So Dr. Madhusudan should know what, if he has a first-hand information of what has happened to this patient, it becomes very easy for treatment. So always carry your medical record. So how epilepsy is managed? Up to 70% of patients with epilepsy could have had their seizure controlled with right medication. This is not happening. I think awareness, lack of awareness is not, is making our patients suffer more. Anti-epileptic drugs are taken regularly to prevent seizures from happening by reducing the brain's excessive electrical activity. AEDs are not used during the seizure to stop it, and they do not cure epilepsy. The fits medicines are given to stop a fits. It is not mentioned, or it is not intended to cure a fits. There are different types of epileptic drugs. I think Dr. Madhu will take it through. And AED that someone has prescribed depends partly on the seizure types the patient has. And for some people whose epilepsy do not respond to AED, they may have undergo surgical option. Sometimes surgery may be needed, or sometimes other neuromodulation and other techniques may be considered. So what are the tips for seizure medication? Seizure medication, most important, they should be taken as prescribed. It's a body weight. The dose is dependent on the body weight. Your fits medicine dosage may be different from other patient. No two patient is same in epilepsy. Always we have to customize treatment, customize investigation for a individual patient, and set reminders if you forget to take your medicines on time. Sudden discontinuation of medicines can result in withdrawal fits. Use of any other medication should be discussed. Usually we will give a chart what all the probable side effect related medication. Earlier days, this was the biggest problem, because phenytoin, carbamazepine and other medication, phenobarbital was being used regularly because they were all having a lot of interaction. But now we have a lot of newer medications, so with little side effect or minimal side effect. And do not change the medicine without consulting a doctor. The most important mistake what our patients make is, suppose I write Levipil 500 mg 2 times a day for 3 months and come after 3 months. So after third month, suppose if patient is out of station or he is not able to meet me, he will stop medicine for 1 week because I have written for 3 months. So he will not come at 3 months. He will stop medicine. He will end up in emergency of a hospital with a seizure. Then again we start the medicine. Again the same cycle continues. So till you meet the doctor, do not stop the fits medicine, because as per the law, we can't give medicine for 1 year, 2 years, or 3 years. 3 months, maximum 6 months in special situation. There is a maximum validity of a fits medicine prescription. During that time, you have to meet your doctor, or please continue the medication till you visit your doctor. Don't stop on your own. Don't listen to some unauthorized persons or some other patient who had a different experience. Some other patient would have had a low sugar related fits. He would have settled down. He will never have another fits in his lifetime. But your fits may be different. So please trust your doctor. Don't trust other layman or other hearsays. And please, because your life is most important. I think I'll stop at this stage. Thank you very much. If any questions are there, I'll be able to take it later. I think Dr. Madhu will, I hand over to Dr. Madhu. Thank you.
Thank you, Dr. Sharma. It was a wonderful talk on overview of epilepsy. And now I will be speaking about the epilepsy myths and facts. That's a very important topic for this day, because epilepsy is associated with many stigma in our society. So Dr. Sharma has updated about what is epilepsy, what are the causes, the triggering factors, and what are the types of seizures, and what is the role of the medications, and how to make sure you take medicines regularly and all. So I'll be speaking about the myths and facts towards the epilepsy, and a little bit special advice to the about women with epilepsy. So, before knowing about the myths, we should know what are the challenges in the management of epilepsy. See, there are two important challenges. One is patient-related challenges. Another one is the physician-related challenges. The patient-related challenges means they are social isolation, dependent behavior, psychological issues, reduced quality of life, economic burden, and adverse effects. These are some of the patient-related challenges which they face. And what are the doctors or physician-related challenges is diagnosing the epilepsy properly, choosing the right drug for the right seizures, that is, for the right AED has to be chosen for treating an epilepsy. And we should know, is there any drug interaction with the drugs, the one-to-one interaction with the drugs, with the other comorbid conditions for which the medicines have been prescribed by the doctors. And in case of uncontrolled state, so what is the next option that we should know? And in special populations, so what are the challenges we face? And the comorbidities have to be considered in mind always when you are treating a patient with epilepsy. So coming to the topic per se as epilepsy myths and facts, I'll go to the myths and then the facts. The red color, the words are all the myths, and the next, subsequently, I will tell you the facts. So the first myth is people with epilepsy are mentally ill or emotionally unstable. This is what the people think about that. Actually, it is an epilepsy is an umbrella term covering many types of seizures and epileptic disorders. It is a functional disorder, physical problem, and not a mental problem. And it has many unidentifiable causes which has to be identified. So we should not send him for mental illness clinics like that. They may be suffering from other comorbid conditions, but we have to treat that. The next myth is you can swallow your tongue during a seizures. It is physically impossible to swallow any of the tongue. And next myth is you should force something into the mouth of someone having a seizure. This is not correct. If you force something into the mouth, you may break the teeth, or you may injure the gum, or even break someone's jaw also sometimes. So the correct first aid is very simple. Just gently roll the person on one side and put something which is soft under his head to protect him from getting injured. You should restrain someone having a seizure. Never use. This is also one of the important myths. The correct way is you should never restrain the patient with seizures. The seizure will run its course and you cannot stop it. If you try to restrain any patient with seizures, he may land up in dislocation of the joints, or there may be chances of fracture in those patients. The next myth is epilepsy is contagious. Actually, epilepsy is not a contagious disease, and you simply can't catch epilepsy from another person. It is a non-communicable disorder. The next myth is only kids get epilepsy. The people think that people will not get epilepsy in older age groups and all. See, people over the age of 65 almost often, they also get seizures like children, and seizure in the elderly are often the after effect of other health problems like stroke and health heart diseases, and all these things can have effects on the brain, and they can land up in seizures in elderly groups, especially if they have the tumor, malignancy, surgeries, head injuries, and post-stroke seizures are known. People with epilepsy are disabled and can't work. That is a myth. So people with this condition have the same range of abilities and intelligence as the rest of us. Some have severe seizures and cannot work. Others are successful and productive in challenging careers. And many of the patients with the seizures are able to do good professional work. And also they are able to play many of the international games, and like cricket and all, many of the stars are there who are suffering from epilepsy. Still they have become stars. Then people with epilepsy should not be in jobs of responsibilities and stress. This is a myth. People with seizure disorders are found in all walks of our life and at all levels in business, governments, and also arts and professions. We are not always aware of them because many people even today do not talk about epilepsy openly, and they have the fear that what the other people will think if they come to know that they have seizures. But professionally, they will be doing well, and they are many of the people are in the top post professionally, also in the arts and all other fields of work. Then, with today's medication, epilepsy is largely a solved problem. Epilepsy is a chronic medical problem that for many people can be successfully treated. Unfortunately, treatment does not work for everyone, and there is a critical need for more research, and many more drugs are yet to come. See, almost newer antiepileptics, there are more than 20 drugs available now, and I think in future we may get even better drugs also. The next myth is epilepsy is rare and there are not many people who have it. That's what the people think, that they are the only ones who are suffering from epilepsy. That's a myth. Epilepsy can occur as a single condition or it may accompany other conditions affecting the brain such as cerebral palsy, mental impairment, autism, Alzheimer's, and traumatic brain injuries and stroke. So next thing is you can't die from epilepsy. That is also a myth. Epilepsy still can be a very serious condition and individuals do die of it, but not all the seizures will have this problem. Experts estimate that prolonged seizures, especially status epilepticus, are the cause of many of the deaths each year. And that goes unnoticed in many times. The next myth is you can't tell what a person might do during a seizure. Seizures commonly take a characteristic form and the individual will do much the same thing during each episode. His behavior may be inappropriate for the time and place, but it is unlikely to cause harm to anyone. People with epilepsy are physically limited in what they can do. This is also a myth. In most of the cases, epilepsy is not a barrier to physical achievement, although some individuals are more severely affected and may be limited in what they can do. So Dr. Sharma told about do's and don'ts in epilepsy. I am going to highlight a little bit about do's in epilepsy. To aid someone having seizures, take these steps. First thing, important thing is keep calm. Do not panic. Prevent the patient from injuring himself. Block the fall of the person onto the ground. Loosen their belt, necktie, or other tight clothing. Remove the spectacles if they are wearing. Cushion their head. Clear away any of the sharp objects or hard objects. When the seizure is over, turn them on their side to prevent choking. After the seizure stops, turn the patient to a side and wipe the froth from his mouth. Then comes the don'ts in epilepsy. What are the don'ts you have to remember is, do not panic, as I told you earlier. Do not be afraid. Do not insert any spoon or any of the articles into the mouth. Do not restrict the convulsive movements as it may cause fracture. Do not try to insert a gag into the mouth. It may cause difficulty in breathing and also hurt the helper's fingers. Sometimes even they may cut the fingers also. Do not crowd around the patient. Give sufficient space for the patient to breathe. Do not give water or any other liquid till he is fully conscious. Do not try and physically hold the person. This may injure both the person and also the helper. Medical aid is usually not required except in the cases of a person who is in the water and is getting seizures, and then he will be having a danger of drowning. Then mouth-to-mouth resuscitation may be required. Duration of seizure is usually not more than 2 minutes, after which the person enters into a state of deep sleep. So what are the first aid do's you should know is, keep a cool head under pressure. Focus on your goal to keep the person safe until the seizure stops. Move things out of the way. Remove the individual's eyeglasses, ties, scarf, necktie, or spectacles, whatever is there, and keep him in a safe environment. Place something soft and flat under the head. Try to turn the person on her side. Time the seizures. Note down the time of onset of the seizures. An epileptic seizure will generally last only 2 to 3 minutes. Check for the medical identification. Someone with epilepsy should be wearing a medical bracelet or a card containing the emergency contact number or information, what medication patient is taking, and any of the drug allergies he is having. This may be useful because if the patient is taken to the nearby hospital, if it is easier for the doctor to treat him if they know what medicine patient is taking and is they allergic to any of these drugs. And control the crowd. If you are in a public place, clear a path for the emergency medical workers and tell onlookers to move along. So what are the epilepsy first aid don'ts are? Don't restrain the patient. Don't offer the food and drink. It may cause aspiration. Don't put anything into person's mouth, and don't perform the CPR. A CPR or artificial respiration unless the person is not breathing when the seizure has stopped. So caregiver care is also very important. What caregivers must do is important. If you care for someone with epilepsy, the things you do support them may include keeping them safe during the seizure, give the first aid when there is a need and emergency medication has to be given. Noting any of the pattern or trigger of the seizures, which may help if they don't recall their seizures, helping with their routine of taking anti-epileptic drugs, going with them to appointments, helping to take the notes, or providing descriptions of the seizures to the person with epilepsy and or to the doctor is very important. Acting as a representative or advocate for a person with the doctors or others involved in the care is important. Joining in with leisure activities might pose a safety risk if they were to have a seizure, such as swimming and all. Providing transport, if necessary, is very important by the caregiver because they are not supposed to drive the vehicles or they are not supposed to swim also. Helping them to adopt their home or lifestyle to provide a safe living environment is what the caregivers can do. And I would like to tell a few points about women with epilepsy also at this time. See, every woman needs to give herself and her health extra care during pregnancy, and you have epilepsy, it's especially important to not skip that. In addition, it's a good idea to discuss pregnancy with your obstetrician and gynecologist and also with your neurologist before you start trying to become pregnant. Take prenatal vitamins and folic acid to lower the risk of birth defects. These supplements should be started before pregnancy and continued throughout the pregnancy. Keeping up regular appointments with your care team to get your seizure medication levels checked important. Do not stop or start or alter the dose of any of the medications without talking to your physician. Make an extra effort to get more sleep. This is also very important. And points to notice, in pregnancy, there is a twofold decrease in the seizure occurrence during or just prior to the menses in some women. Some medications to treat epilepsy may interfere with the effects of oral contraceptive pills. Women with epilepsy may have a menstrual irregularities. Seizure frequency can increase 17 to 33% for women during pregnancy. Prenatal exposure to AEDs is known to increase this risk to 4% to 9%. The American Academy of Neurology also supports breastfeeding in women taking AEDs with close monitoring. Some drugs are restricted in the breast milk should be avoided. So points to note is when compared to the general population, women with epilepsy are at increased risk of falls, fracture, osteoporosis, and osteopenia because of the hormonal variations. Seizures are known causes of fractures in patients with epilepsy due to an increased susceptibility to falls. So now, what are the myths and facts in especially the women and also in pregnancy that we should know is, the myth is, I don't need to take any extra steps or precautions due to my epilepsy before I get pregnant, just while I am pregnant. This is a myth, because the fact is, if you have epilepsy and want to get pregnant, it is important to start your journey with a plan. Because without planning, if you do, the chances of getting the abnormal baby or congenital malformation is more, and also the patient may land up in trouble during the time of pregnancy. The next myth is, it's hard to get pregnant if you have an epilepsy. That is a myth. See, people with epilepsy or women with epilepsy can become pregnant like any other woman. Only thing, they have to take extra little precautions. They have to plan their pregnancy, and the medications has to be adjusted before pregnancy, and close monitoring during the pregnancy is required. Just then the myth, another myth is, I can't take epilepsy medication during pregnancy. That's a myth. Actually, the fact is, you can take the medicine. In fact, neurologists usually recommend continuing the epilepsy medications throughout the pregnancy. You may need to adjust your dosage or switch to a newer drug if the drug what you're taking is harmful during pregnancy, but you probably won't need to stop medication altogether. Some epilepsy drugs are less often recommended for pregnant women because they can cause developmental problems or birth defects like a cleft lip, spina bifida, cardiac malformations, and all. So another myth is, if I have epilepsy, my baby will have it too. This is also a myth. It is unlikely that all the people will have epilepsy after the birth. See, many of the people have got normal babies and they're having a very intellectual babies. They're doing well. The next myth is, getting pregnant is not safe if you have epilepsy. It causes more seizures. The fact is, there are risks, but these can usually be controlled. The majority of the pregnant women have the same seizure frequency during pregnancy. In fact, some women even have fewer seizures during pregnancy. The next myth in pregnancy is, if you have a seizure while pregnant, it will lead to miscarriage. It's not necessary in all the cases. This is it's not a fact. Then the myth is, I will have to have a cesarean section in almost all the cases. That is a myth. In general, epilepsy has no impact on your delivery method. Just like women without epilepsy, you can also have a baby, vaginal delivery, or through a cesarean section. It depends upon you and your physician, treating doctor, or obstetric gynecologist. Next myth is, I won't be able to breastfeed if you are an epilepsy patient. The fact is, it's usually recommended by major organizations like American Academy of Pediatrics and American Academy of Neurology that you should do breastfeeding, and even our Epilepsy Foundation people also have disseminated this information to many of the areas. So this is the seizure diary, which is very important, as Dr. Sharma was telling. Epilepsy diary is a quick method, simple way to record your day-to-day experience with epilepsy. Be sure to take your complete diary to share with your doctor during your appointment, because this helps to know what is the seizure frequency and what are the different types, how many times the patient had a seizures and all. Thank you. And I end my talk at this time, and I think Dr. Pradeep is going to take off from here about the epilepsy emergencies and how to treat the epilepsy emergency. Over to you, Pradeep.
Yeah. Is my slides visible?
Yeah. We can see.
Am I audible?
Yes, you are audible. Over to you, Pradeep.
Well, at the outset, I would like to thank Dr. Nirmal Surya, President of IAN, and Dr. Madhusudan, my good friend, for giving this opportunity to share our knowledge with the general public on the occasion of Purple Day. Today, I'll be mainly talking about what emergency care should be given when someone comes across a patient who is having seizure or epilepsy. And almost like my previous speakers has already elaborated like what has to be done when everyone come across a person with having the seizure or epilepsy. Maybe my talk will just reinforce whatever they have already shared. See, as Dr. Sharma has explained what is a seizure, it is nothing but a transient occurrence of signs and or symptoms due to abnormal, excessive or synchronous neuronal activity in the brain. So whenever there is an excessive, uncontrolled neuronal activity in the brain, a person can have a seizure. And epilepsy is recurrent unprovoked seizures. So if they have repeated seizures, then it is called as epilepsy. If patient has one episode of seizure, that doesn't quantify as persons having epilepsy. However, if patient has one epilepsy, there is a subsequent recurrence risk of 60% in their lifetime. Then, in spite of one seizure, they can be told as they will be having epilepsy. If they have some epilepsy syndromes, like if a person has a seizure for a particular age, like there is always a risk of having some recurrence of risk. They will be classified into epilepsy syndromes, like Dr. Sharma has told, like myoclonic epilepsy or absence epilepsy. If someone fits into these syndromes, then in spite of one seizure, it can be told as persons like they have epilepsy. So whenever a person has seizure, what will be the recurrence risk? If it is untreated, 36% by the end of 1 year, they have recurrence of seizure. At the end of 3 years, 48% would have had. By end of 5 years, at least 56% would have had a recurrence of seizure if left untreated. Usually in lifetime, around 10% of people can have a seizure, one episode of seizure in their lifetime. So what will be the natural course of a person with seizure? Usually like first seizure, most of them will...
Pradeep, I think slides are not moving. Just you have to scroll down the slides.
No, is it not moving? Fine.
Just can you scroll it down?
Is it moving?
No.
Now? No. 1 second.
Yes, sir.
Can I do like this? Is it moving like this? Is this fine?
Now it is moving.
Fine. Okay. Okay. Now see, whenever you come across a person with first episode of seizure, without treatment also they will go in for remission, and very few people will progress into early epilepsy. And those with early epilepsy, with like 65% of them will get treated with single AED, like their seizures will be under control, and around 35% of persons will have chronic epilepsy. In this chronic epilepsy patients, persons with chronic epilepsy, with combination of 2 AEDs, 20% will have epilepsy under control, and remaining will go into drug resistance. And persons with this drug resistance, maybe like around 60 to 70% will be eligible for epilepsy surgery, and another 5% will be maybe with combination of drugs, like their epilepsy can get controlled. So whenever, what will be the AED response? Like whenever you start a person on treatment, what will be their response? Usually with first monotherapy or second monotherapy, around 60% of people with epilepsy, their seizures will be well controlled. However, roughly around 40% will have difficulty in getting their seizures controlled. And with addition of third monotherapy, it is not like drastically their seizures get controlled. Only maybe 1% get 1% to 2% by individuals get their seizures under control. See, the most of whenever a person has a seizure, most of the seizures will last from 30 seconds to 2 minutes. And very rarely, as Dr. Madhusudan has told in his previous slides, it may last, very rarely, it may last more than 5 minutes. And if the seizure lasts more than 5 minutes, like if it is convulsive type of seizure, now according to the new definition of status epilepticus, it is it is called as a status epilepticus. What is status epilepticus? Status epilepticus, it is usually an emergency. If it is a seizure duration, if it was lasting for more than 30 minutes, or if there is no regaining of consciousness in between 2 episodes of seizures, it was called as status epilepticus previously. What was the rationale behind choosing 30 minutes was the seizure is more than lasts for more than 30 minutes. It used to give rise to irreversible neuronal injury. Okay, so that was the reason that told this arbitrary duration of 30 minutes was chosen. However, many clinicians prefer think that seizure should be stopped early, aggressive treatment should be started before 30 minutes. So based upon this one, a new definition has come out for status epilepticus. So it can be a tonic based upon based upon two time patterns. One is T1 time, when a seizure is likely to be prolonged, leading to continuous seizure activity. That is, if a seizure occurs for 5 minutes, it being prolonged, the chances of it getting prolonged is more. So whenever it is prolonged for more than 5 minutes, it is a tonic-clonic event. It is called as status epilepticus. Whereas in persons with focal onset seizures, with the focal status epilepticus with impaired consciousness, usually if they have duration of 10 minutes, you should start treatment. In absence status epilepticus, usually if they have this event lasting for 10 to 15 minutes, you should start treatment aggressively. So this is the new epilepsy, status epilepticus definition which has come out. Sorry. So another most important thing is whenever a patient has repeated seizures, as already discussed by the Madhusudan and the Sharma, this is nothing but a sudden unexplained death in epilepsy. What is it defined as? It is death in a patient with epilepsy that is not due to trauma, drowning, or status epilepticus, or because of any other known causes. So these deaths can occur because mainly they have impaired breathing. Mainly whenever a person has prolonged seizure, there can be a pause in his breathing. If these pauses are very prolonged, this decreases the oxygen in the blood, which can be life-threatening. But also because of during convulsive seizure, whenever the person is shaking and is doing like this, his airway, that is the trachea, may be covered or obstructed with secretions. Literally, there can be a block in the trachea, so there won't be any air exchange from the atmosphere into the lungs. So this can lead to the suffocation. And also, whenever patients can have this seizure, there will be abnormal, it can cause an rhythm disturbance in the heart. So sometimes heart can stop functioning. That is called as a systole. So these things has already been discussed. Whenever a person comes across a person having seizure, it has already been told elaborated as 3S by Dr. Sharma. You should stay with the person until they're awake and alert after the seizure. So you should time the seizures. Why is it most important? If the seizure lasts more than 5 minutes, it has to be treated aggressively. So the emergency team has to be informed. The hospital has to be informed so that ambulance comes and they can be given more preference for the treatment. Always remain calm. See, whenever you see a patient, everyone will get, the person is seizing, everyone will be nervous. So try to be as calm as possible. So this will be reassuring for the person who is around you also. Look for any medical ID if he has any reference, if he has any drug treatment or any other conditions he has. So look for any medical ID which can give you light on us medical conditions which he has. So I've told you always you should time the seizure so that we can come to know if it is very prolonged, an emergency help is to be needed. So because it has to be treated as status epilepticus. As already told, most seizures last only few minutes. If it is very prolonged, aggressive, care has to be given. So whenever you come across a person with seizure, make note of his head movements, look for his eye movements, look for his changes in breathing, and look like how long the movements last, look like which arms are jerking. So because it helps, like suppose a person is having right hand movement, it indicates that seizures are coming from the left side of the brain. Usually like right side of the brain controls the left side of the body, and vice versa. So left part of the brain controls right side, and right side of the brain controls the left half of the body. And also see like how long a person takes time to recover from his seizure. Okay. So whenever you come across like a seizure, the most important thing is keep the person safe. So like move or guide anything which is create an environment which makes them secure. So do not put anything into their mouth. Do not restrain them. Cushion their head so that they feels that person is safe. Give time to recover. Also time the seizure. Move any hazardous things away from the patient. Don't restrict their movements. As Sharma has rightly mentioned, like people have sometimes have sat on the as a patients, or they try to hold the patients with jerking hands. So that should not be done. So and always stay with them, reassure with them, and also like once they're recover the consciousness, reassure them and just tell them like what had happened to them. And another S is turn the person onto their side, because whenever if they're not on the side, they're on their back, chances of airway secretions going into their trachea or that airway is more. So this has to be secured. So make them turn one side, make them as comfortable as possible. During a convulsion, like sometimes person would have stopped breathing. That may be because of chest muscle tightness, which happens because of a seizure. When the seizure ends, the muscles will relax and breathing will resume normally. So as it has been previously commented, rescue breathing is generally not needed during this seizures in emergency. So whenever you come across persons with seizures, do not restrain, do not put any objects, because whenever you put objects like spoon or wallets, because that jaws will be tight, they will they may swallow that object or break their teeth. Sometimes, as we all know, because there will be tongue bite, you need not worry. After that, when patient recovers, as Dr. Madhusudan has told, no one will swallow their tongue. So don't worry. The only thing is you make sure that he is not injured, his airway is clear. If at all, if there are some rescue medications, if you know that rescue medications, in their pocket or in you can try to place them inside the cheek. Don't give water or food which will which they need to swallow, because when patients are confused, chances of food or liquid or pills going into the lungs are more. So if they have this one, they will have choking. So don't try to stop movements or forcibly hold the person. Restraining can lead to injuries. And be whenever people are aggressive or during the seizure, it is not like they will be fighting. See, the seizure itself will be giving rise to that type of phenomenon. If they're restrained, when they're confused, they may become more aggressive. If person is able to walk around, make them sit on a safe enclosed area, so that everything is they're not they don't get injured and all.
Dr. Pradeep, another 4 minutes.
Yeah, fine, not an issue. So always whenever they stay away, whenever they're awake, be sensitive and supportive, because we know sometimes seizures are frightening, so it would have frightened the surrounding people also. And also once people get wake up, they feel little embarrassed, if someone says they had epilepsy, so some people may get embarrassed. Reassure that person that they are safe, and when they're alert, you just communicate them what has happened, and if it is required, stay with them. Or if required, you can accompany them to the hospital also. So what to do when there is an emergency? So when to call a person, when to call for emergency help is, someone without a history of seizure, as Dr. Sharma told, someone first time with a seizure, seizures occur one after another. That is, clustering is there. And if a seizure lasts for more than 5 minutes, that is called as status epilepticus. And seizures occur closer than normal, very frequently. And if a person has trouble while breathing. So for first aid, what reading is not important. See, learning how to do it is more important. Make sure that you practice seizure first aid by holding seizure drills with your family is done, so that whenever it is required, maybe you can help some persons with seizures. And maybe from the Indian Academy of Neurology, all this the seizure drills should be taught at college level, so that everyone can be aware, so that what has to be done. So when they come across someone having seizures, it is also critical to know that what has to be done during the seizure and how to give this rescue treatments correctly and safely. And whenever you come across seizures, please remain calm and comforting. Ensure nothing blocks their breathing. Move away any harmful objects. Keep something soft underneath the head. Turn them to their side. Time and record the seizures. Don't be alarmed. Don't leave person unattended. Do not restrain as they may lash out. Do not forcibly hold them. Do not put anything into their mouth. Do not offer water, food, or medication. Do not gather around. And see, there is some medications when continuously patient has continuous seizures beyond 5 minutes, something called as status epilepticus, which will be taken care in the hospital. So in the hospital, what they do whenever patient is rushed to the hospital, they look for their airway. They'll stabilize their airway, breathing, circulation, and also they will look for any disability is there during the routine neurological examination. If there is any impaired they will give oxygen via nasal cannula or mask, so that saturation is maintained. They will do ECG monitoring to look for any abnormality in the heart rhythm, and also they look for any abnormality in the blood glucose levels, because whenever there is the low glucose, patients can have seizures. So they will do this IV access, and they will look for try to look for any routine electrolyte abnormalities, or they will look for any toxical, they will look for any drugs or any toxicological screen will be carried out, so that if they have taken any drugs which can give rise to seizures. And also at the same time, they can look for if patients are already on anti-seizure medications, they can send for that levels, so that we can come to know whether the drug level is a correct dose or not. Usually once they come across, they will usually give either benzodiazepines as initial drug, either like midazolam or lorazepam. In spite of this, if their seizures are not controlled, they will give first line medications like phosphonatoin, sodium valproic acid, levetiracetam. In spite of this, medications is not controlled, they may start on IV midazolam infusion. And if it is not controlled with IV midazolam infusion, they may start on IV anesthetic agent. So this will be the management of status epilepticus in the hospital. And if patients continue to have seizures beyond 24 hours, it is called as super-refractory status epilepticus. So the most important thing is, whenever you come across a person with a seizure seizing, the first aid is most important. And if it is, you should know what are the do's and don'ts, which has already been discussed by my previous speakers. So first aid, most important thing is what to do. First aid is most important. And if it is prolonged for longer time, you should inform the emergency people to the nearest hospital, so that they can be taken care immediately. Thank you. Any questions? I'll be very happy to answer those things.
So thank you, Pradeep, for a wonderful talk on epilepsy emergencies. And I think Dr. Sharma has joined. On the occasion of this Purple Day, Epilepsy Awareness Day, today, 26th March, every year we celebrate this Purple Day by wearing these purple bands, purple shirts, or we tie up purple balloons and all, so that the epilepsy patient get benefited more, and they have to know that epilepsy is a treatable condition. At the outset, I would like to thank Dr. Suryanand Sharma from Apollo Hospital, Dr. Pradeep from MSM Medical College, and our IAN President, Dr. Nirmal Surya Sarji, for giving the opportunity for us to talk on this important day. There's a Epilepsy Awareness Day. If Dr. Nirmal sir is there, then he can say a few words.
Thank you, Madhusudan. It's really an honor to be here for both to start with and to end with. You know that today is a very hectic day, Purple Day. I have been addressing from morning 10 o'clock onwards continuously. Not a single minute that I have been able to spare for myself from one meeting to another meeting. And it's all about the epilepsy. You can, as you rightly mentioned, the purple band. So I'm also wearing the purple shirt and dark purple tie. Fortunately, today we had Cassidy Megan, and she addressed all the patients at our foundation. Cassidy has a special relation with Epilepsy Foundation. She is the founder of Epilepsy of the Purple Day, and she has been awake till 2 o'clock in the morning to address our patient, because she has met all of them 4 years ago. We invited her to the Mumbai, and then I have taken her to all 4 states like Punjab, Ludhiana, and then Bangalore, Indore. So she went around in Chennai. So she has went around everywhere and interacted with people with epilepsy. I must say that today the ceiling, Bandra Worli ceiling, the iconic tower or ceiling, which is iconic for Mumbai, will turn purple today. So those of you who are here in Mumbai, they will have an opportunity to see that. And what I want to send a message to the people with epilepsy, that epilepsy is no different. There are great people in the world who had an epilepsy. You have an stops working, and that's the reason you have this issue. I always say that you people have more current in your brain. Epilepsy patients have more current in the brain, and you need to cool down your current by medicine doctor is giving, but you need to take care of other things like yoga, keeping yourself cool, not stimulating your brain by either awake in the night or fasting, and taking any measure which increases the current in your brain. So if you have understood that, I think you can conquer the epilepsy. My best wishes to all of you. I think don't get disheartened. It is one disease. You can fight, continue it, and you will overcome. There are so many new drugs available. There are so many new avenues available. So that's it. Don't bother about it. Thank you.
Thank you, sir. Thank you for a wonderful message. And we are going to end this session now.
Thank you, Dr. Madhusudan, for coordinating this beautiful public interactive session on epilepsy.